For pancreatic cancer, there are things which we cannot do anything about, like age of the elderly patient or diabetes. These are the things which are beyond us. But there are things which are lifestyle related, like stopping smoking, no alcohol, then sedentary habits. I think we have to exercise and have a balanced diet. Those are important things which can help in prevention of pancreatic cancer.
This silent killer needs to be picked up early. Public needs to be aware of the common symptoms so that they can seek medical advice early. It requires treatment and management under an expert team which is available at hospital setups in our country. And we suggest that whenever one notices unexpected features like loss of appetite, loss of weight, especially in the background of risk factors, one should contact the doctor early for early diagnosis and treatment. Hello everyone, I'm Dr. Vivek Tandon, and today I have with me Dr. Deepak Govil. We are both directors at the Department of GI Surgery and GI Onco Surgery at the Medanta Super Specialty Hospital in Noida. Today we'll be talking about pancreatic cancer, what its symptoms are, what are the risk factors, and what are the treatment options. So Dr. Govil, tell us about the pancreas first. What is this organ and what is the function that it has in the body?
Thanks, Vivek. Pancreas, in fact, is a small but a very important organ, and it lies hidden behind the stomach. It has a head, body, and tail. It's an elongated structure which lies between the part of the stomach, behind the part of the stomach, and the duodenum, which is the early part of the small intestine. It has a head, body, and tail, and the function it performs is an important function for the body. It secretes all the digestive enzymes which help in digestion of the fats, proteins, and carbohydrates, which helps in digestion of the food. And also it produces insulin, which is important for maintaining sugar and energy levels in the body. Also, an important thing is that the location is very complex because the pancreatic duct, which joins the bile duct, it forms an area which is called as ampulla, where the pancreatic juices and bile duct juices come together and are secreted into the intestine. So these are the areas which are really important, which has an importance in the treatment of the diseases associated with pancreas.
So, Dr. Govil, now coming to the issue of symptoms, how does a patient come to know that he probably has a pancreatic disease, and specifically in the context of pancreatic cancer? What are the symptoms that one should watch out for?
Actually, it's important that pancreatic cancer usually is called as a silent disease. It is called silent because the symptoms are usually not seen in the initial phase. So majority of these patients come quite late to us. And like the important symptoms which the patients come is, one is jaundice, that is the yellowness of the eyes, yellowness of the urine, and jaundice is associated with a lot of other factors like itching, the stool color becomes pale. So all these factors are jaundice related. Another important feature of the patient is sometimes these patients, especially if there is a tumor in the body part of the pancreas, they may just present with pain in the upper abdomen, which is sometimes very excruciating and going towards the back. And a specific characteristic of the pain is that if you stoop forward or you sit, there is relief in the pain. While you lie down, the pain increases. So these are the important presenting symptoms for pancreatic cancer.
So, Dr. Govil, if I put it again for our viewers, that means that lesions in the head of the pancreas are the ones that produce jaundice, whereas pain can be part of any lesion in the pancreas.
Right.
But are there any other common symptoms that a patient should watch out for?
Yeah, I think apart from jaundice and pain, main is general weakness, general loss of weight, loss of appetite. These are really important. If the patient has loss of weight, loss of appetite, it is pointing towards probably some pancreatic cancer disease which may be residing there. Then other important things are if sometimes the patients who are not diabetic are detected to be a diabetic. So it is called as a new onset diabetes. Suddenly a patient gets diabetes. That is also seen quite often in these patients. Also, if there is a change in digestion habits of the patient, these also may be an indication towards a pancreatic cancer.
So, to summarize, that means that jaundice, pain, loss of weight, loss of appetite, a new onset of diabetes, or worsening of the diabetes, these are the symptoms which a patient should watch out for.
That's right.
Dr. Govil, are there any specific risk factors that predispose a patient to the development of pancreatic cancer?
Yeah, definitely. Actually, there are a lot of lifestyle factors which are important. Like if the patient is smoking, smoking is a very high risk factor for pancreatic cancer. And it is said that a lot of patients who have pancreatic cancer are chain smokers or smokers for a long duration. Other lifestyle factors are alcohol, obviously, is an important factor which can lead to pancreatitis and pancreatic cancer. Apart from that, there are other factors like family history. If there's any family history, if there is a patient who has multiple cancers in the family, there are chances that they may be suffering from pancreatic cancer in the long run. Then if there is a patient who has prolonged diabetes, those patients also sometimes can have pancreatitis or chronic pancreatitis, which can lead to pancreatic cancer. So all these aspects can be a predisposing factor for a cancer of the pancreas.
Dr. Govil, now we come to the question of how to diagnose pancreatic cancer. When patients come with these kind of symptoms such as jaundice, weight loss, loss of appetite or pain, and you're suspecting them to have a pancreatic lesions, what are the common investigations that first are asked for?
See, basically these patients, once we suspect on the basis of these symptoms, if they're having jaundice or pain, on the basis of these symptoms, we investigate these patients. But the initial investigations are the basic investigations, like certain blood investigation, a simple liver function test. If a patient is jaundice, liver function test gives us a lot of information because the jaundice can be due to other causes also, whether it is due to other causes or obstructive causes, that can be identified on the basis of liver function test. Then there are certain markers for cancer, which are not very specific, but yes, they give an indication that probably we may be dealing with a pancreatic cancer. Like there is a serum CA 19.9, which is an indicator. If it is levels are significantly high, then we can suspect a patient with a pancreatic cancer. Apart from that, a very basic investigation which is today available in almost all OPDs is an ultrasound of the abdomen. Like if there is a patient who has had jaundice, ultrasound gives us a lot of information regarding the cancer, if it is there, where is it, what is the level of cancer. A lot of information can be obtained even on an ultrasound, basic ultrasound of the abdomen.
And Dr. Govil, once these tests begin to point towards a pancreatic cancer, then what are the special investigations that are usually required to confirm the diagnosis?
Yeah, once we suspect on the basis of ultrasound and basic investigation, then we go on to further imaging, which can be in the form of a CT scan or an MRI, depending on the location where we identify or suspect the cancer. These are the basic imaging things. Plus, PET scan also today gives an idea of whether there's a localized cancer or a disseminated cancer. So these are the imaging things, CT, MRI, PET scan. All these can indicate that whether we are dealing with a pancreatic cancer, plus also give the details regarding pancreatic cancer, the extent of disease, which may guide towards the treatment of the pancreatic cancer.
What about biopsy? Is a biopsy required to confirm pancreatic cancer?
Yeah, I think routinely biopsy is required, but since in these patients it's a difficult area, as I said, pancreas is located in a very posterior area behind the stomach, depth area. for biopsy, we have to do an endoscopic ultrasound and get a biopsy. And a lot of times biopsy may be negative. But if our clinical suspicion and other suspicions are high, we still go ahead with a surgical procedure. So it's not required in 100%, but yes, it is a desired investigation.
So you mean often one may have to go ahead with treatment without confirmation with the biopsy in this situation?
Yeah, we prefer to get a biopsy since the procedure required is a fairly major procedure. We prefer to have a biopsy before the procedure, but in case we have other evidence which is supporting a pancreatic cancer, sometimes we do operate even without a positive biopsy.
Coming to the treatment now, Dr. Govil, once we have confirmed the diagnosis, what are the options for treatment in these patients?
So options for treatment, it is important, as I told you initially, that it is a silent disease. So a lot of patients present in an advanced stage. So if they are treatable or surgically treatable, the number of patients who will be resectable surgically are not very many. And surgery is the mainstay of treatment for a pancreatic cancer. Maybe 20 to 30% are in a stage where we can remove the cancer, where it is a localized disease and surgical results are good. So majority of these patients would present at a time when it has spread to other areas, when surgery may not be possible. But surgery is the mainstay and it may be requiring other treatments, but preferably surgery is the treatment, but it's a major surgical procedure. So we have to see all aspects of the diagnosis. We have to discuss in detail with the patient and the attendants regarding the nature of surgery before we go ahead with these procedures.
So, Dr. Govil, do we tend to move straight away to surgery, or do some patients require treatment modalities like chemotherapy prior to the surgical procedure also?
See, as I said, that surgery is the mainstay of treatment, but in these patients, sometimes if it is not clearly resectable, so it's called as borderline resectable tumors. So in those patients, we give some treatment in the form of either a stenting or a chemotherapy, radiotherapy before, then we give it some time to heal, and then we go ahead and operate these patients. But if it is not resectable, then in those situations, we only are left with options where we give chemotherapy, radiotherapy, and other palliative options to these patients.
So some of the patients who may initially not be amenable to surgery those are the borderline resectable ones, may get converted to resectable lesions.
That's right.
After such treatment.
That's right.
You said about palliative treatment. So 70 to 80% of patients who cannot undergo a resectional surgery, that is to remove the tumor, what are the treatment options for them?
See, for palliation, basically patients have jaundice, patients have intestinal obstruction related to the treatment. Those require a treatment. Like if there is jaundice which is very high, patient has a lot of itching. In those situations, we have to put in stents which can be put in endoscopically, which will help relieve the itching and other things. Plus, we can give chemotherapy and radiotherapy also along with that with these patients. But otherwise, sometimes even small surgical procedure may be required to relieve the obstruction of the stomach or the bile duct, even for palliation for these patients.
Dr. Govil, what about prevention? We talk about treatment, but is there anything that can be done to prevent the occurrence of this cancer?
Yeah, actually, for pancreatic cancer, there are things which we cannot do anything about, like age of the elderly patient or diabetes. These are the things which are beyond us. But there are things which are lifestyle related, like stopping smoking, no alcohol, then sedentary exercise, sedentary habit.
So viewers, as we heard today from Dr. Govil, this silent killer needs to be picked up early. Public needs to be aware of the common symptoms so that they can seek medical advice early. It requires treatment and management under an expert team which is available at hospital setups in our country. And we suggest that whenever one notices unexpected features like loss of appetite, loss of weight, especially in the background of risk factors, one should contact the doctor early for early diagnosis and treatment. Thank you.